Go.
Let's get into it. Yeah, it started from nothing. Now I charge per breath. I was overlooked. Now I'm booked past death. Had tables turned. I flipped the room. Now they whisper my name like I'm bad juju. I birthed trends they try to mimic. Did it solo, ain't no gimmick. They took notes while throwing shade. Now they pressed and I got paid. I'm not one of them. I'm one of one. Trying to match my glow. Baby, you're outdone. I'm made for bigger. Not basic. Made for thrones, not fake shit. I don't chase, I check. I don't follow, I flex. I'm made for bigger things. Tell the room I said what I said. Big body blessings, big boss moves. Try me and end up a lesson. They talk about me in rooms I don't enter. I haunt them like regret, make them bitter in the center. I'm that girl, the headline in the smoke. They playing in mirrors, I'm shattering your.
That song just does something to my spirit. You hear me? I love
You
it.
have me shout.
I know, right? It's feel it bubbling up on.
Yes, motivational. Yes.
All right. Welcome back, everyone, to 90.1 WMPR Ask Astria, where I am your health and fitness professional, bringing you health professionals for real life situations and answers to all of your health needs. Today, we have a returning guest, Dr. Phillips. Hi, Dr. Phillips. How are you?
Hello, I'm doing well. How are you doing?
I am doing well today.
All
It's
right.
been a pretty laid back day. I had to take a mental health break today.
All right.
I had to take a mental health break.
Yes, we got to put those in.
Yes, you
Those
got it
in.
every now and on a Monday. I need a mental health break on a Monday. That's it. That should tell you something about my life. Mental health break on a Monday to get
Yeah,
the
you are a woman of many talents. So I understand. I understand.
All right. So, Dr. Phillips, would you just tell our listeners, in case they didn't hear last time, what is it that you do?
Okay, my name is Dr. LaDonna Phillips. I'm a doctorate of nursing practice. I practice here in Laurel, Mississippi at the Family Health Center, which is a rural health clinic. I am dually certified. I see adult physical medicine. I treat geriatrics on up in physical medicine and mental health. I see children to adult until geriatrics. I'm a mental health provider as well.
I love it. Mental health. Mental health is entwined into everything. We were just talking about how this conversation can go all over the place because
Mm-hmm.
people don't understand, like, car accidents, mental health. Passing away of family members, mental health. Just relocating and getting a new job opportunity that's even a better opportunity.
Mm-hmm.
You still have to take into account your mental health.
Mental
So mental
health.
health touches a lot of everything. And I wanted to bring you back today because this is Men's Health Month. And
Okay.
I like to really hone in on the men when it comes to their health needs and concerns, and to hopefully motivate more men to get into the habit of practicing preventative health care,
Mm-hmm.
those preventive services and those actions to get into the doctor and find out if anything's going wrong before it gets to those final stages, because
Okay.
that's when the problem really comes in. That's when it costs more when you go in after something has already broken down, I guess you can say.
Mm-hmm.
And so I'm going to start off with some questions. All right, and we're going to see where the spirit leads us, and we're just going
Okay.
to flow with this thing. Is that okay?
All right. Yes. Come on, spirit. Okay.
Spirit. All
Yes.
right. So, first question: a lot of men feel like they have to tough it out. We talked last week. I spoke with Mr. Ronald Henry, a doctorate of pharmacy,
Mm-hmm.
and gave a personal story about his health scare and how he was glad that he didn't succumb to the stigma of being a man and toughing out some of the pain that he was feeling, and how he found out that he had prostate cancer
Mm-hmm.
and had to go through that experience. So men feel as if that they have to tough it out when they go through something. Why do you think so many men struggle to talk about their mental health?
It's
And
just. Oh, go ahead.
no, no, and
It's
that's
just, the way the culture is. It's just the environmental expectations of men. Men are taught to be resilient, to be, it's the stigma surrounding a man's mental health. They don't want to be perceived as weak.
Mm-hmm.
They don't want to be perceived of don't know all the answers. So they try to evade conversation that shows weakness, or to escape their feelings of weakness. So men are very complex. I mean, it's just the cultural expectation. I mean, they are taught very young, at a very young age, tough it out. You don't supposed to cry. That doesn't hurt. Work through your pain. You can look at young male athletes. If they spring a foot, they're taught to suck it up. That doesn't hurt. Go a little further, run a little further. Ignore the pain. So that transcends to their mental health when they get of age. That's how they think. I'm supposed to avoid or overlook my pain or isolate my pain.
Do you think that it is a little bit of that they don't know the signs and symptoms of mental health challenges, or do you think that they know and they're consciously sitting down and saying, "Hey, well, just kind of dust it off, I know, or do you feel that a lot of our men are aware that they
I
might have
think it's a. Oh, go ahead.
no, that
I
was
don't
it.
want to cut you off.
You're
Okay,
fine.
but I
It's
think
okay.
it's a little bit of both.
It's a radio show. You can overlook. Everybody can talk at one time. It's all right.
Okay, I think it's a little bit of both. A
Mhm.
lot of it, they know they're aware something is wrong, but if you've been verbalizing your feelings and been told to suck it up or stay strong or deal with it, you learn to do just that. And a lot of times some just don't even recognize the symptoms because this is how they've been trained to act, or this is how they've been dealing with stuff for so long. So they're not aware that this is not the right way to deal with this situation.
Do you feel that I think about men and mental health challenges, and I think about our culture because we go back
Hmm.
and say it's because of our culture. Do you think the women, because when you really look at it, because sometimes I have to go in my brain and I have to go in there and look around my brain and just dissect some things. And when I say that, I'm saying when I really do sit down and really do think about it, you only have male and female.
Hmm.
And so if men are being told to suck it up, then the only people that are telling them to suck it up is going to be other males, of course,
Hmm.
and
And
females.
women,
So
because
do you
it's
think that the message, so my question is, do you
hmm
think that the message when it comes to men's health should be just as straightforward and stern to women as to how they support men with their
hmm
mental health? Because it can be, you coming to me, I can imagine being a man and a woman comes to me saying, you got some mental health issues and some challenges and you need to go get some help. That's not gonna help me go get some help.
hmm
So
you got to meet them where they are. And
mhm.
a lot of times, if you expect someone to be vulnerable, you got to show them compassion and give them a safe space to be vulnerable. So, and to be condescending or to be aggressive, you're only going to receive that response, or you're going to be like, well, this is enough. Because men are already having a hard time to share. You know, they're not as forthcoming in sharing their feelings, like, because they're not trained to. They're trained that women are softer, so they needs to be stronger. Or don't no woman want a soft man. So they
Mhm.
have to be that
You don't
pillar
have
of
to whisper,
strength.
Dr.
Yeah, I'm sorry, but they have to perform. They have to put on this pillar of strength. They have to be that, not only for themselves but for the woman also. And this is what they're being culturally taught by society, and so that's why it's so hard for them to seek help.
And so I want to ask a question, but I'm gonna kind of push that question out a little
Uh-huh.
bit. I want to have a little bit of a discussion because it is culture and it's hard because as a woman that came from a household of at least five strong, opinionated,
Mhm.
single African American women,
Mhm.
I grew up thinking that it was natural to yell about everything
Everything.
that
Mhm.
you did. I mean, and I also remember when I got to it when I went off to college, and I noticed that everybody wasn't communicating with each other yelling. And I
Mhm.
learned just from observation that that's not the normal way of communicating. So when I went back home, I never forget, I was sitting right next to my aunt, and my aunt said, Pinky, go in there and get me some water. And I looked at her and I said, why are you yelling at me? I said, you don't have to yell at me. I love you.
Mhm.
Sitting right here. And she just looked at me like,
She's not yelling.
what is
That's
going on with you? like, like, what are you talking about? I'm not yelling.
mhm.
So the question is, how difficult is it going to be to support our men? Because I think that that shift is going to have to start with
Mhm.
women.
Yeah, and we got to be very intentional.
We're going to have to be very intentional on
Mhm.
changing our tone and not
Mhm.
just talking about it, because it's the cool thing right now, Dr. Phillips,
Mhm.
on social media.
Yes.
Everybody's talking. It could be my algorithm, though. You know, I know
Okay.
stuff. It could
But
be my algorithm on relationships.
mhm.
But it seems that relationships and talking about narcissists and talking about how men behave this way and that way, and woman deserves. And while I do agree with that, I think that we do need to take a realistic look as, and I'm going to say African American women.
Mhm.
And I say that because it is our African American men that are where that health gap, which I learned
Mhm.
Mr. Ron
Mhm.
last week, that health gap is wide in the African American community as far as getting the mental health, going to the doctor, getting those preventive care
Mhm.
checkups. So it's almost a little discouraging to me, because it's like, oh my gosh, it's going to be another 20 years at least before our men are feeling comfortable with addressing their health before something terrible is going on, because we have to go back to another cultural shift of getting these women, and when I say these women, I'm including myself,
Yeah.
to be
Uh-huh.
very conscious as to how we are speaking to the men. Because now, and I know I'm saying a lot, right?
Mhm.
I'm kind of
I
having
got you. I'm following you. Yeah.
and it's because it's a process. That's the hard part. Because
Mhm.
as a woman
It's
who did
important.
change
Yeah.
my tone, when you go back and you talk to a man with a different tone, he doesn't, the first time you do it, he doesn't just understand that. It's going to take some
Mhm.
time and some mistakes, and for you to be consistent through him still being the same, and to see your change through multiple attempts, which is hard to do because you only have,
Mhm.
listen, I said it nice one time and I
Mhm.
said it nice a second time. I don't know
Mhm.
how to, it seems like you only understand when I
And
yell
I
at
get
you,
out.
I'm
Yeah.
crazy to you.
Mhm.
So how challenging do you think that this shift is going to be to get our women to also see that we're just as responsible culturally when it comes to culture as to motivating and guiding our men to take care of their health?
I think it's going to be very challenging. Like I said, it's going to be we have to be very intentional about behavior changes, because some behaviors are learned. Like if we saw mom did, we saw dad, and we saw the interaction between them, that's how we going to perceive until we learn to do better. We got to want to learn to do better and know that this conversation, or to learn to promote a compassionate, loving environment that opens up a man to tell you his true feelings or to be vulnerable. Because how many, like I said, I was probably in my 30s or 40s before I saw my dad cry.
Mm-hmm.
Okay. And he
Mm-hmm.
was a military
Mm-hmm.
guy, and it was a death that made him cry. I never heard him express his feelings about anything.
Mm-hmm.
So that needs to change, because we got to realize that the emotions, the stress is going to come out somewhere or the other,
It
you
is.
know. And most time men find themselves being treated in the ER because of stress, anxiety, and depression, r- rather than seeing their provider, because they don't want to talk about it. It makes them seem weak. And even Superman cried. You know what I'm saying? So
Mhm.
if Superman was this pillar of strength and they showed him crying, it's normal for a person to cry. If you hurt, you're going to say, ouch.
But you know
So,
something, Dr. Phillips?
uh-huh.
Man wasn't an African American man.
I know,
I'm sorry, I
but
hate to say it.
we got to change that. We got to get our African American men, because the suicide rate has increased in our Black young African American men. We're Black and African
Feeling
American.
it. Their feelings
Yes.
affects.
Yes.
And I think that that
And
is
no, okay. Can I
hell.
say this one thing?
Yes,
One thing.
please do.
What's really is, how can I say it? Most men use barbershops when they were older
Hmm.
as an outlet. You go to a barbershop, that was therapy sessions. How many barbershops are in our communities now?
I don't know. I don't go to barbershop.
Yeah, but I'm just saying, if you ride by,
Yeah,
you don't hardly ever see a barbershop anymore. You
really.
know, because young men are now braiding their hair. They're not going to the barbershop. They're either growing afros, or so they don't have that camaraderie. When my brothers or my dad was growing up, they went to the barbershop. And when you go to the barbershop, you have all sorts of men there. You have preachers, you have doctors, you have a camaraderie, and you can really express yourself and talk amongst each other. But now, if you take that component out, where do men go talk? Where do they go to release themselves,
You know, and
their
and
emotions?
and there may be an age gap here, but
Mm-hmm.
from me just observing, but then I feel like that's the blessing of being in the South in Mississippi, is that
Mm-hmm.
you can see the world before the world actually gets to you. They say we're behind, but I'm like, yeah, but I'm
Mm-hmm.
watching you all, and I'm like, okay, so when social media hits here, don't
Mm-hmm.
do that. But I think that social media platforms are gonna have to figure out a way to to take up that space,
Mm-hmm.
have some private groups and things, but that's kind of hard when you know that you're being recorded, when
Yes.
you know that you're online. I mean, how vulnerable can you
Can
really
you get?
trust?
Mm-hmm.
Now with AI, you really have no control over technology. It'll be,
Mm-hmm.
so I don't know. I mean, are the other spaces, I mean, are people don't go to church as much as more,
Mm-hmm.
people are either on church on the internet, or they just kind of stop post pandemic. So
Mm-hmm.
I'm trying to think.
That's
I mean, where would be a
and
safe space?
they're gonna have to either find a friend,
Hmm.
find a pastor, or find a provider. They're going to have to first step is recognizing there is a problem
And
and
so, what are some
accepting that.
signs where they can say, "Hey, maybe I need to speak to someone"? Because I do think that the next relationship needs to be. I think everyone needs to find their therapist.
Mhm.
Yes.
Mhm.
So, what are some signs that African American men can see that are not typical?
Mhm.
Say, "Hey, I might have some mental health challenges."
Okay, one would be aggressive, being aggressive, irritable. If I can ask you a simple question without you blowing up per se, that could be a sign of increased stress, depression, anxiety, um, a controlling type of behavior, feeling numb or emotional disconnected. You could see someone that used to drink sociably. Now they drink every day. Someone that didn't smoke, now they're smoking, or someone that didn't vape, now they're vaping, or someone that didn't use other substances like marijuana or cocaine or something. Now they're participating in those habits. Insomnia, trouble sleeping, or not, or sleeping too much, not being able to formulate a sentence, or losing the ability to concentrate or focus on stuff, not losing interest in stuff like someone that used to golf or plant gardens. Now they don't have any interest in that, or we call it escapist personality. They escape or evade their feelings by working all the time. They work excessively. They work out excessively.
Hmm.
You know, they used to go to the gym 3 times a week. Now they live at the gym.
Mm-hmm.
So they avoiding their troubles at home or wherever the problem, the stress is at. So they avoid it and escape it through the gym or work.
That's a lot. That's
Mm-hmm.
a lot, but they're all pretty simple everyday
Mm-hmm.
things that you probably will come across about at least five of those tests
Mm-hmm.
a day. It's like, how am I responding to people? Am I avoiding things? Am I being excessive in my one activity versus the other?
Mm-hmm.
So, are there any tools online?
Well, you could do what we call a PHQ-9, and you can fill that out. But it's helpful to do that inside a medical facility up on a medical provider. That way they can explain it a little bit more what those numbers mean. They
So could you
also
do it at home and then take it to a medical
Mhm.
professional?
You can just to get clarity, because those numbers mean something, even if it's a mild number, or you say, well, I got one or two, or something else could be going on. So I don't want you to take those numbers at face value.
Mm-hmm.
Okay, you can fill it out. You can I hate when people play Google Docs, or be a Google doctor, because Google is so black and white and we got a whole bunch of gray. Okay. So 1 plus one in Google land is always going to be two. Okay.
Also,
But in the medical field, 1 plus 1 can be something other than two, if that makes any sense.
oh,
Okay. So trouble sleeping on Google Doc can be a whole bunch of stuff. In real world, it could be just trouble sleeping. Okay, that's what I'm trying to get at.
okay,
So
thank you.
just don't take what Google says as face value without clarifying it with your provider. So if you do the PHQ-9 and you Google what that means, your score means, don't take that at face value without clarifying that with a provider.
I think I might have a little bit of a solution for that.
Okay.
What about, I think, telehealth. I'm gonna
Oh,
put that
ooh,
out there. Telehealth.
much needed.
Telehealth is a challenge. They always want to say, well, telehealth is not good because you can't see the doctor. What happens when I need this is what telehealth is for. Do your do your assessment, book a consultation or book an appointment with the provider, just mental health space. And I think that if we did that and did that with our therapist or again someone like you in the healthcare setting and spoke about our results and gave the results via telehealth, it's private,
Mm-hmm.
confidential. You're speaking
Mm-hmm.
with a healthcare professional. You don't have to, you can just kind of pull over on the side of the road and
And it's
speak with them.
accessible. Yes.
It's accessible. And a
Mm,
lot of times it's free. I don't
yes.
think people understand that as well. So I'm gonna make sure so we need to put PHQ-9 on the
Mm-hmm.
website, and we also need to put a little more information about telehealth. And
Yes.
I really do think it's a great idea because you have to get in the practice of being in that environment.
Mm-hmm.
So if you're using telehealth just to see a healthcare provider for mental health, it's going to make you more comfortable with turning to your healthcare organization for assistance, and you feel more comfortable communicating with the provider. Did I
Mm-hmm.
did I get that right?
You got that absolutely right.
Yeah.
Okay, because telehealth can be very, 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 very. We need it. Just put it like that. We need it. And we need it to be more accessible, especially in our rural communities, where people don't have transportation to and from doctors.
Mm-hmm.
That's a a great source, a great tool for them to get the help that they need. And most people are very from the stigma. They don't want to come inside of a mental health facility.
Mm-hmm.
If we can provide that privacy and let them just pick up the phone, nobody knows who they're talking to. It could be a FaceTime, it could be something, and then they're just getting the help that they need.
You
So
know,
it's very vital.
I like to be honest about the challenges that I have as far as
Hmm.
it comes to taking care of health, so that the world can see that everybody, I like to make sure that I am relating. I've even called NAMI once
Hmm.
because I was having a very stressful time in my life. And I woke up, it was a Sunday morning, and I called NAMI.
Okay.
Is it NAMI? Is it NAMI? That's
Yeah, I know what you're talking about. Yeah, uh-huh.
yeah. And so we'll put information about NAMI, but that was a wonderful 1-800 line that didn't report me as being harmful to myself,
Mm-hmm.
but they were someone who I could just just let it out to
Mm-hmm.
right then and there. And they guided me to go and start speaking with a therapist.
Okay.
It really was my first step before I started to see a therapist. I was like, I need to call someone. And I had no clue. It was on a Sunday. Had no clue who to call. And so I knew about numbing because I've done all these programs, but I'm like, so let
Mm-hmm.
me use these resources. And it was a wonderful experience. They were very nice. They spoke very softly. They didn't speak a lot. They let me do all the talking. And
Mhm.
they encouraged me to go and speak with a professional, a therapist. And I'm very grateful. So telehealth is something that we can do another show about and go
Okay.
down the rabbit hole with, because
Mhm.
there's so many, so much that people think when they think about telehealth. They think about their grandmother going to the doctor.
Mhm.
We're talking about just first things first. I tell people, don't even
Mhm.
worry about all that. First things first, mental health is June. Men, women, do the PHQ-9 assessment.
Mhm.
Book an appointment with your local, you can do it with your local FQHC. Find
Mhm.
out. You can either go to Family Health Center if you
Mhm.
need to, and book a telehealth session and just see if everything adds up. And how often do you suggest that someone performs a mental health assessment for their everyday self, their care for themselves?
Okay. Usually, like if you know yourself, if you're pretty in tune with yourself, once a year, if you don't have any diagnosis of depression or anxiety, if you just want to see where you're at, and that could be done with the side that wellness visit that we talked about last year. I mean, last segment. Or if you know something is off, and if you feel if that first number just didn't give you what you think was going on, follow it up within 2 to 3 weeks, then follow it up in 3 months. But definitely, when I say do it, you need to be, if you feel like it's off and you don't feel like you don't, the number doesn't match how you feel, please follow it with a mental health provider. Just don't take the number at self value. That's the most important thing is, yes, you can screen with the PHQ-9, but you need to follow up with the healthcare provider.
You need to follow up with the healthcare provider, and you can do that via telehealth.
Yes,
That
yes.
is that's the word.
It's convenient. It's convenient for you. Doesn't
Mm,
require a whole lot of time. You can just call and ask for a telehealth visit or consultation. And then they can upload the PHQ-9. You can fill it out prior to your appointment. And then that way the provider can have that information at the appointment. And then y'all can go over that, the meaning of those numbers during the consultation.
I love it. I love it. All right.
Okay.
Well, Dr. Phillips, if you would, let us know again how someone can reach you, just in case they want to follow up with you,
Okay.
as a mental health specialist.
Okay, I am employed with the Family Health Center of Laura. We're located in Laura, Mississippi. My phone number that I can be reached within the clinic is 601-425-3033. And you just ask to schedule an appointment with Dr. LaDonna Phillips. And like I said, I see adult um, physical medicine patients and also mental health patients.
I love it. I love it.
All right.
And so, thank you, Dr. Phillips, again for joining us with a follow up. Men's health, men, it's not that we're not saying we don't need any assistance, but this month is about you. It's about taking
Mhm.
care of you, and we really let us know what it is that we can do to support you during the month of June. All
All right.
right. Thank you all for joining us for
Mhm.
another episode of Ask Astria. And I am your health and fitness professional. And thank you for joining us on 90.1 WMPR.
All right. Thank you for having me.
Oh, yeah. Started from nothing. Now I charge per breath.
You were kind of calm
I
this
was
time.
overlooked.
I did.
Now I'm booked past death. Had tables
That's all right.
I
turned.
thought Sally
I
went
flipped the
coming. They weren't coming,
room.
but